mother of 15-month-old twin boys. Their names are Jake and Max. They are just starting to walk. They're the pride and joy of my life. They were 7 weeks early, so I've always been more cautious about their health care. And Max has a lot of allergies. He's allergic to milk, and he's allergic to soy and caseins and all this other stuff. So I definitely have to keep on top of everything and make sure that they take their medications and that they are constantly growing, because for the longest time they were not even on the growth chart.
I am the chief and wellness healthcare person in my house because, you know what, men, well, my husband in particular, just he works all the time. So, when my kids are sick, he's just like, yeah, you're fine. So basically, I'm the big chief in the house as far as medical care, taking care of it, and who's going to be their provider.
My role as chief health and wellness person in my family is mostly how everybody else's is. When my daughter was little, I picked out the pediatrician, and we move around because of my husband's work. So every time that we have to move, I have to go through the provider list and find doctors for us in each place. And then I have elderly parents. I was responsible for taking them back and forth to the doctor, and it wasn't always easy getting him into one.
My husband, on the other hand, thinks he has everything that he needs, but sometimes he tends to put off some of his tests, and I have to remind him it's been over a year since he's had an eye test or other things. I sometimes accompany him to the doctor because he really doesn't understand some of the things he does.
As far as being the chief cook and bottle washer with my health care, I am to a degree. All of our insurance issues were discussed between my husband and I, but he takes care of all of his medical needs by himself because he's a big boy. I take care of the kids, which are usually dental and some bruising, and once in a while a shot.
Usually on a typical day, I call the doctor for my mom because she has diabetes. So I schedule her plans around that and mine as well, so that I can take off from work or make my schedule around that. Then approximately a day or two later, I get both of her and my prescriptions filled because I'm anemic, so I have low blood. So I get iron pills prescribed to me. I don't really mind. I'm so used to it now, just doing the work for both of us.
Like a lot of families, my role in healthcare is predominant. Like, I make all the appointments for my family. I handle any insurance stuff that needs to take place. I pick up medications, and of course assist my children to and from appointments and sick visits.
I take care of my health as well as my elderly mother's health.
I am in charge of mine and my children's health care. I got these guys. I'm in charge of getting them health insurance, and I am in charge of making sure they're up to date with their shots and taking them to doctors when they're sick, or when they're at sports if somebody gets hurt. We have new health insurance, so then I had to find their new primary doctor.
As far as my role as the chief health and wellness officer of our household, mostly that involves taking care of my own appointments. I currently have 2 chronic diseases in which I have to go to the doctor often. I have celiac disease and narcolepsy. I also take care of my husband's appointments because, like most men, he doesn't do a lot of things for himself. So I'm usually the one to encourage him
to go to the doctor, if not the one that makes his appointments. Sometimes I go with him because he doesn't always remember to ask all the right questions.
In my family is I do the appointments, I go with them to the appointments, I find the doctors, pretty much do everything.
I do all the healthcare decisions for my daughters. I make all their appointments. One of the things I do for my husband, he's very technology adverse. So I got him to sign a proxy for me so I can manage his healthcare information online on his behalf. So if he wants to email his doctors, I do it for him. I show him his lab results, etc., etc. So I'm definitely his go-between.
My boys are ages 5 coming this Thursday. I have a 9-year-old, and then I also have a 13-year-old. My older 2 boys, they do play sports. So we're always doing something like physicals or regular doctor's visits. Also having boys, we've been to the hospitals, the emergency room, unfortunately, quite a few times.
A few years back, my son used to have seizures. So all times of night, we would end up having to run to the ER.